Let's face it, it's a boozy culture here in Charleston. Imbibing on alcohol is a way for friends to gather and good times to be had, but it's also a toxic way to escape from problems. Joining us with more on alcohol addiction during this pandemic and emerging from the vicious cycle of self-medicating is Dr. Melissa Fritchie, addiction medicine specialist for MELMED Recovery. Thank you so much for joining us.
Thank you.
Yeah, so what do you think is the level of pandemic-driven alcoholism?
Well, we know that drinking has increased during the pandemic. I have certainly seen this in my own patient population with those that I treat for alcohol use disorder. We know simply from alcohol sales that drinking has increased. And we also know from the recent Harris poll, which specifically was looking at drinking behaviors during the pandemic, that drinking and at-risk drinking has definitely increased.
Is this drinking due to stress or drinking out of boredom?
Well, I mean, there are a lot of reasons that folks turn to alcohol. It is certainly one of the more maladaptive coping mechanisms that we have to handle stress. Yeah. And we all know that stress has increased for most people during the pandemic.
Can you define what alcoholism is? Is it binge drinking? Is it functional alcoholism? What does it look like? What quantifies alcoholism?
Right, that's a great question. There are broad categories that we look at, which include heavy or at-risk drinking. And that is measured simply by the amount that folks are drinking. There are some different measures that we can look at, but the very simple thumbnail sketch is that for a woman, if you are drinking more than 4 drinks in a sitting, or for a man, if you are drinking more than 5 drinks in a sitting, that's considered heavy drinking. Heavy drinking places folks at risk for physical consequences. We all know liver issues, cardiovascular effects, and then of course the mental health aspect of it. But true alcohol use disorder, which is what we talk about in the business of addiction medicine, is defined by criteria that people have moved beyond just the physical symptoms and the amount of drinking that they're doing, but actually having some of the more negative legal consequences, social consequences, things like that.
Well, it's National Recovery Month. Where does a recovery begin?
Well, that's a great question. Of course, the first step is assessing whether or not one has a problem. So there are some easy ways for folks to screen for problems. Understanding how much at-risk drinking is for a male or female. There are also some online options where you can take a screening test yourself. Auditscreen.org is one of the well-validated studies that we use, and there are some other options for online resources for that. Being aware that you may have a problem is key, but then also understanding that there are treatment options for folks. The recent Harris poll, one of the interesting findings was that very few people were aware that there are treatment options available for mitigating some of the withdrawal symptoms that people have that cause some discomfort, and also medications that may be available to help people stop drinking or even moderate drinking that are easily available in an outpatient setting.
Absolutely. And there's numerous ways for people to reach out, one of which help.org is another website that you can go to, and you can contact them at this National Drug Helpline, 1-844-289-0879. And then also for family, Al-Anon. So let's not forget the family that witnesses alcoholism of a loved one. So what would you recommend for them?
Family absolutely needs support. We talk about addiction actually being a family disease. It affects not just the person who suffers from addiction, but in addition, 4 or 5 other family members frequently. And it's very important for family to have education about what addiction is, how to interact with someone suffering from addiction to make sure that they are helping and not hurting that person.
Right.
So I strongly recommend that families get involved with recovery groups. Favor Spartanburg is a great recovery group out there, as well as Al-Anon that you've already mentioned.
Right. And there's many chapters all over the country for Al-Anon, absolutely. Dr. Fritchie, thank you so much for joining us today.
Thank you.
Very good food for thought. Appreciate it. We're back after this.